While I am a physician, the information presented in this podcast is for educational purposes only and should not be considered medical advice. It is not a substitute for professional medical advice, diagnosis, or treatment. Please consult with your own healthcare provider before making any significant changes to your lifestyle or routine. By listening to this podcast, you are not creating a physician-patient relationship. Welcome to the Purposeful MD podcast. As a physician, you've sacrificed so much of your life for other people, your patients, your family, your friends, and your colleagues. What would it feel like to spend time doing what you enjoy and to live without guilt? I'm your host, Dr. Laura Sutton, a family physician, certified coach, and business owner. If you're a medical professional on a journey towards your most purposeful life, a life with more time and energy, and ultimately more joy, then this is the podcast for you. Welcome to the Purposeful MD podcast. I'm really excited to have our guest, Dr. Nerissa Kreher, with me today. Dr. Kreher, we had a chance to meet in California at a mastermind event in person, and so really happy to have you. So you are the former chief medical officer of a biotech company, now chief medical officer consultant, a pediatric endocrinologist. You transitioned into the pharmaceutical industry early in your career and now have accumulated more than 18 years of experience working in biotech and pharma. Started your career in medical affairs and moved to clinical development. You have experience in small to large biotech, both private and public companies, and you have an MBA from Northeastern University. Really happy to have you and just excited to talk to you and learn a little bit more about you and how you are supporting other physicians and how you got started in pharma and biotech. Welcome.
Yeah, thank you, Laura. It's great to be here. Thank you for having me.
Yeah. So tell us how you got started and where you are now.
Sure. So, as you mentioned, I'm a pediatric endocrinologist. I was in the middle of a move related to family and had done a master's in clinical research during my fellowship. So, I very much was on an academic path. I wanted to do clinical research, really enjoyed that during my fellowship. And during the moving process, unfortunately, the clinical research job that I had secured was cut. And so the institution offered me a role, but it was to do clinical medicine. And I never really enjoyed that during my fellowship. I really enjoyed seeing my research patients. And so I decided that before I would accept that role, because, we were a young family, I needed a job, I would look around and understand what other options were out there. And to be honest, pharmaceutical industry was not on my list, but a pharmaceutical sales representative who represented one of the recombinant human growth hormone companies asked if I would share my resume with her. And I did and sort of laughed it off, thinking that will go nowhere. And in fact, that's how I landed my first medical affairs job. The company reached out, asked me to interview, and I was supporting actually that recombinant human growth hormone in the medical affairs arena.
That's awesome.
Yeah.
Yeah.
I
Yeah.
think it really says a lot about your network and utilizing your network, because that sales
Sure.
representative, was really instrumental in where I am today.
Yeah, for sure. I mean, a story that ended well related to a pharma rep, and how they're, like you said, leveraging their networks and your network. And I mean, she clearly had you in mind, and so put your name through. So yeah,
Right.
yeah. And now you're coaching physicians who want to transition into pharma and biotech as well.
Exactly. Yes. So I won't go through all the roles throughout my career, but as you mentioned in my bio, I have worked in both medical affairs and clinical development for almost 20 years now in the pharmaceutical industry. multiple different roles. And I worked my way up from a director level, which is a typical sort of entry level role for a physician in pharma, to chief medical officer. And I served as chief medical officer for three different biotech companies. And during COVID, when, there was a lot of strife in medicine and obviously I think continues to be, I wanted to be able to help my physician colleagues. And I don't practice anymore. I couldn't go and manufacture PPE for my physician colleagues, but I knew people were hurting. And so I decided that I would offer people some form of training and coaching around the options that they have, specifically related to pharma and biotech. And that's where the Industry MD Coach was born.
That's so cool. And I know I've said this to you before. I just think that that's such a unique opportunity for physicians who, we hear about non-clinical careers and physicians wanting to either transition out of practice and into something else or maybe supplement their income with something similar. And I don't I don't know if pharma is always at the top of somebody's list, but I know it's been a great career for you and you really enjoy it and you clearly shine when you talk about it and you're really passionate about it. So I love that you are helping to open those doors for physicians who may want to enter pharma and biotech. I hadn't met anybody before really meeting you and getting to know you that really has kind of avenues in this way and has been in the field for so long and can help coach physicians toward that. So I just really admire that about you and somebody who's so passionate about it.
Thank you. I think that, through, my career, I know a number of physicians, right? And it's probably 1% of all physicians, maybe 1.5% now. The stats are pretty hard to find in the United States, but if you look at like Germany or the UK, it's about 1% of physicians work in the pharma industry. So I suspect it's something similar in the US. So we're out there, but I do think, there's some stigma around pharma. And so maybe physicians aren't advertising that that's what they're doing. But, related to the stigma, what I say to people is there are good and bad apples in everything, right? Good and bad apples in medicine and in medical practice. And I think that's the same in the pharma and biotech industry. But through almost 20 years again, what I've seen is most people are trying to do good in our industry.
Yeah. Yeah. I'm glad you brought that up because that's something that, we hear and I'm sure you see rants about it and that type of thing. I come from a large healthcare insurer background and it's just like anything, there's good players and bad players, like you said. And I think the reality is we need pharma. Right? This is where our development of new drugs comes from and a lot of our research. And so we can either rant against it or we can be good collaborators and work to partner together. And I think that's one of the things that I think is great about what you're doing is that you're helping to bring more of the good players into pharma because that's what we all need is good players in every aspect of healthcare. So
Exactly.
yeah, yeah. And so we were talking before we hit record about some of the mindset challenges that we both see in our practices. Me coaching medical professionals, not necessarily specifically on transitioning into pharma, but you kind of mentioned that with the stigma, and we talked a little bit about imposter syndrome as well. So what are the things that you see when you're coaching physicians?
Yeah. I think first, we've in general had our path paved for us, right? If you want to become a physician, you need to go to medical school, you need to do a residency, some people do a fellowship. And so the path it's a bit unlike other people finding a job because it's easier. Easier the path, not the actual doing it, of course, but it's laid out for you. And so pharma is not at all like that. The interview process can be confusing. A lot of times people get quote unquote ghosted because they never hear back. And we're not used to that because most physicians easily find jobs in most areas. The jobs are, lots of openings and such. And so I think that that's the first part that I walk people through is this is actually more of the real world than what we've gone through in our medical training. The other thing, of course, is to become a physician, typically you're an overachiever, you're a type A, you've, accomplished everything you've set out to do. And then you find yourself applying for pharma jobs and you're getting denials and you're getting rejections. And that doesn't feel good to physicians. We're not used to that. It's not sort of part of what we've had to go through. And I'm generalizing a bit, of
Mhm.
course. But helping people through those and just walking them through what's the norm, what should you expect, and setting the expectations appropriately is one of the first things I work with them on because it is so different than the typical medical practice pathway. I think the imposter syndrome piece, I always find that fascinating. We underrepresent everything that we've accomplished in our medical training. And I'll just use one example. People will not want to count their years of residency and fellowship as job experience. And of course, that is on the job experience, right? I mean, you're
Right.
very responsible for a lot of things during residency and fellowship. And so I have to sort of coax many of my coaching clients to count that as experience. And they question it. They wonder if the interviewer will question it. And it's never a question, of course. So just giving ourselves credit for all that we've done is really difficult for physicians. I think we hold ourselves at such a very high standard that we almost shoot ourselves in the foot because of that very high standard. So those are a few of the things I see. Um, I could probably go on, but those are a few of the key ones that I typically see.
Yeah. It just makes me think, and you mentioned it about how as physicians on our career path, if we take the quote unquote traditional path of medical school, residency, maybe fellowship, we're kind of insulated a little bit, like you said, from the job search that the rest of the world goes through. And so some of those skills we may never have the chance to practice at all. Or even that CV building. I remember building a CV to apply for my master's program, and I was already pretty established in my career. And I had to go back to my medical school application from like almost 20 years prior. And I still had my high school jobs on there. I'm like, oh gosh, I really need to make this look more professional. So thinking through those things and how as physicians we just don't have a lot of those same skill sets or have the opportunity to use them. And yeah, the imposter syndrome related to residency and fellowship, not thinking about that as a job. That's interesting to me. Um, I mean, I see that too in my clients is we discount a lot of our hard work, Oh, I'm just a whatever. I'm just a primary care physician or I'm just a whatever. I'm just an attending. Like, wait don't discount that. That's incredible what you're doing.
Yeah,
So,
it's so funny you say the just I've written probably a few blogs about that, but I hear that too, a lot. I'm just a family practice doctor. I'm just a pediatrician. Yeah. The other one, actually, I just saw this on a Facebook forum the other day, was on the flip side, highly trained specialists who have gone through a fellowship training then sort of use that against themselves as well. So instead of thinking about, I think this was an anesthesiologist. And so instead of thinking about what do they know as an anesthesiologist, right? They know respiratory medicine, they know cardiovascular medicine, they know a lot. I mean, like go on and on, right? Neuro. And being able to look at that and then apply it to a role based on the job description and sell themselves. Also, we get no training on that, which is an interview skill,
Hmm.
right? And they sort of say, I'm just an anesthesiologist and don't think about all of the systems that they know very well. And that can apply to a number of specialists. So I see the more generalist physicians doing the justa, and I see the more specialized physicians then using their specialties against themselves. So again, we do a lot of that type of coaching that is really mindset related in the work we do, not just the here's the step by step how to create a resume, but it's more the mindset of actually accomplishing what needs to be accomplished.
Yeah. It makes me think of too, not even the clinical skills, but all of the non-clinical skills that are related to, for instance, an anesthesiologist, crisis management and being able to manage complex cases and talking to people when they're most scared about to go into surgery and the people skills that are involved in that and just all of the skills that go into becoming a physician and all of the hard work that has led up to that point, not even to mention all the clinical skills involved.
So
So,
true, so true. And business as well, right? We as physicians typically we're not good at business or we don't know business. We haven't learned business. But if you step back and think about you're managing teams every day.
mhm,
Many physicians are in the thick of the business of medicine, dealing with insurance companies, right?
mhm.
Those are business skills. And again, it's figuring out how to give ourselves credit for things that we actually maybe don't have an MBA. I get that question a lot too,
Mhm.
right? Do I need an MBA to work in pharma? Absolutely not.
Yeah. Yeah. I just saw a question posted on one of our a local physician forum about who has their MBA. I'm considering it. So I started a conversation with this person about I have an MBA as well.
Mhm.
I I think it was really valuable for me at the time. I don't know if it was necessary for what I do now. I was on a different track at the time that I got it. So, but I think it kind of, it's one of those things that I fall into this trap as well, is thinking I need more school or more education or another course or another certification or another X, Y, or Z before I can take that next step. And uh, probably is I just need to jump in and puff my feathers and realize what I already know and the skills that I already have, and maybe don't need an MBA or name your program another form of education in order to make a difference and in order to have the skill sets.
Right. Especially ones that can be incredibly expensive, right? I mean, I have my MBA, so not to be hypocritical, right? But I had the opportunity to do an MBA while I was working for a pharma company and they paid for it.
Hmm.
So if you have that kind of opportunity, that's a different story than, perhaps going further into debt for a few more letters that might take years away from just entering the job market.
Yeah, absolutely. I was also blessed to have my organization sponsor both time and financially with my MBA. So I really enjoyed it. I met a lot of great people, had a lot of great connections, and since I love school, it helped, and there was a coaching component of it as well. So, but yeah, it's one of those questions we have to answer and for ourselves. And I just always go back to the belief is we're telling ourselves that we have to have this degree in order to get this job or take the next step. And it may be true if we're on the CMO track, possibly may not be true. So yeah. What about related to transitioning? I imagine that a lot of the physicians that you coach are transitioning away from clinical medicine, right? Completely and stepping back and moving into something different. So what are the beliefs that you see around that?
Yeah. So I think one of them relates to what we were talking about earlier, right? The stigma of pharma and, what is your family going to think, or what are other physician colleagues going to think? That one, of course, becomes very much a personal decision that you have to dig deep and say, what is going to be fulfilling to me? And the whole, put your own mask on first and take care of yourself. So easy to say, not easy to do necessarily. That one, I think, really becomes meeting people in pharma. So I really recommend that physicians that are at conferences go to the exhibit halls, talk to the people in the exhibits, the different pharma companies, get to know other physicians that are working in pharma and sit down, have a coffee, have a chat with them, and understand what the day to day really looks like. Um, I think, a lot of misconceptions about travel, how much travel, and every job is very different. So, a medical science liaison, they may have to travel 3 to 4 days a week. So, that's a very different story than a medical director in pharmacovigilance, for example, that may have very minimal travel. So some people, I think, just see pharma and immediately think travel and write it off. So it's really more job specific. Um, the other one, and I talk to people about this too, is the grass is not always greener on the other side. Um, there are stressors from working in pharma. We have timelines and deadlines, and sometimes that can be very anxiety producing for people. And so, it's you really have to be in the right mindset to make the transition of something that you're really going after, not you're trying to run away from something. Yeah,
Yes.
we spend a lot of time on that one.
Yeah.
And I try to be really honest with physician clients that if I'm hearing some warning signals that they're just trying to get away from clinical medicine, but they're not really sure what they want to do, maybe we need to step back and do some exploration.
Yeah. And I just love that you're coaching the person, and you've also got so much of this industry knowledge that you've got both hats, and you can see, you can kind of use your spidey senses and your intuition as a coach and think, well, maybe, like you said, is this person, are they running away from something and just trying to break away from clinical practice, or trying to do something different? Or is this something they really want? Do they want to get into pharma? Because if they don't, they're not going to be happy there either.
Right.
So, and you're an objective party, so it's not like you're trying to hire them or trying to move them away. So you can really pick up on that and coach them the way they need to be coached.
Right. Yeah. Yeah. Many different companies, many different experiences, private companies, public companies, small, large, in between. And so, I think that really does help me to point people in certain directions, or, I really don't think you should apply for that job as we get
Mhm.
down into the weeds because of XYZ. And then they're learning and understanding sort of the why behind my recommendations as well.
Mhm. Yeah. Yeah. What's something you wish you had known when you were starting out in pharma and biotech?
Um, I think the biggest thing is I talk to people a lot about, I use the analogy of people in pharma speak different languages. So you have marketing and you have sales and you have finance and regulatory. And so there are all of the sudden all these people from many, many different walks of life, manufacturing, to take it even further. And so, again, we're sort of in this insular world in medical practice where we all speak the same medical language, generally speaking, right? And going into pharma, all of the sudden you're exposed to so many different things. And so I recommend a book called The First 90 Days to people when they've actually signed on. I often will send that to clients. And a lot of that is about listening more than you're talking. So you need to listen and you need to learn. And I will say, I sort of came in like a bit heavy-handed early on because I wanted to prove myself. And probably now I sort of sit back and do a little more listening than talking the first few weeks or months, even.
Hmm. Yeah. I mean, it sounds like it might be overwhelming for somebody new and learning the new language and feeling if there was some imposter syndrome in a previous role that was something that was familiar, now coming into something unfamiliar that might amplify.
Absolutely.
Yeah.
That's a great observation. I think, you also have to remember that you don't have to know everything because there's someone sitting at the sort of proverbial desk next to you that's their job.
Hmm.
And so, understanding that you have to have some knowledge about what the person beside you is doing so that you can have a conversation with them, but you don't have to know everything about their
Hmm.
job. And I think for physicians, that can be pretty uncomfortable. And so just being able to focus on like, okay, here's my task today. Here's what I need to learn how to do. Here's what I need to focus on or the skill set I need. So just being able to focus on that and learn that versus being overwhelmed by everything that could be going on around you. But that's
Yeah.
why everything we do in pharma and biotech is teams based. And so there's a lot of figuring out how to be a good team player, how to be a good part of a team, and work collaboratively with people.
Yeah. I love that. It's just it's so kind of foreign to a lot of physicians, at least physicians my age, where we were chastised on rounds if we didn't know the answer to a question. And so there can be this real fear of, oh, I have to know the right answer. I have to know everything. And learning that that isn't necessary, that the person, like you said, the person next to you, either they know the answer or they can find it out, and really capitalizing on the skill sets and expertise that we do have and not feeling like we have to know everything that's going on. That can be
Yes.
uncomfortable at first.
So very true. I think, the words I don't know are your best friend many
Hmm.
times. And in pharma too, in medicine, of course, there was this overlay of urgent and emergent. And obviously, in the emergency department, you sort of felt like you did have to know everything, right? In
Hmm.
the ICU, if a patient's coding, you have to know.
Right.
In pharma and biotech, there are very, very few times that something is that emergent or urgent. And so it's okay to say, I don't know, but I will definitely know tomorrow, or I will
Hmm.
go and find the answer. I know who might know, um, versus trying to sort of make something up on the fly. Most people can see through that, and it very quickly erodes trust.
Yeah. Yeah. I saw a really funny video. Do you follow Dr. Glockenfleck? Dr. Glockenfleck, and he did one recent. I don't know how recent it was, but I just came across it of a internal medicine rounds where the student asked the attending a question, and the attending said, "Why don't you read up on that and present it to us tomorrow?" And so the student did, and then the attending the next day forgot that he had asked, and so the student was there with his papers ready and stayed up all night. It was really funny. So I think that's another fear of asking a question because we'll get told to read about it and come up with an answer tomorrow, and that
Go do
probably
more
doesn't
work.
exactly. It sounds like that doesn't really happen in the real world. I tell non-physicians that, and they're like, "That really happened to you?" Like, "Oh yeah.
A lot.
Oh yeah, we can all relate. That's why we never asked. We learned to not ask questions." So,
Right.
yeah.
I mean, you're bringing up so much socialization that we receive during our medical training that is truly unhealthy,
Yeah.
right? We would never tell our children, well, don't ask a question. We would want them to be curious and interested and show that. So, yeah, I think there's so much about getting over many of the ways we were socialized, to go out and do any non-clinical career. not just pharma and biotech.
Yeah. Yeah. Awesome. Well, thank you so much. Is there anything else that you'd like to share with us? I'll plug your website and your Instagram as well.
Sure. Yeah. So, I mean, I will say I offer free consultations to hop on the phone and just chat with people, talk about how I work, as we've been talking about. Important the how to, but I think more important is the coaching background and being able to really bring that mindset piece to it, because so much of it is that. I would say 60 or 70% is that. The how to, much of that you can find in other places. So I really am. I really believe that mindset piece is so important. And I think sometimes physicians don't even, we're just so programmed, we don't realize that, oh, this is the block. This is what's getting in my way. So that's one of the things that does differentiate me from some of the coaches that are out there. But great coaches regardless. Yeah, so be happy to speak with any of your listeners that are just curious and want to learn more.
Yeah, thank you. And your website is industrymdcoach.com. You've got a blog on there and a download that folks can sign up, download the material and sign up for your blog, which is very active, you're telling me about.
Yes,
And you're on Instagram as at Pharma Industry MD Coach.
correct.
Yes.
Yes.
So our listeners can connect with you there. Thank you so much for being on. It's great to have you.
Thank you.
Thank you for watching The Purposeful MD on YouTube. If you like what you see, please like and subscribe. Please also visit www.thepurposefulmd.com for free downloads or to discuss working with me as your coach.